Malaria is widespread in Sierra Leone, with the entire population at risk of the disease, and where it remains the leading cause of ill health and death among children and pregnant women. According to the National Malaria Control Program, malaria accounts for nearly 40% of the disease burden among all outpatient visits and an estimated 1,000 deaths annually among children under 5 years. According to the Minister of Health and Sanitation, Professor Alfatijan Wuri, even during this pandemic, malaria is the largest problem the health sector is faced with.
As we speak, the largest problem we have is still malaria. There are higher issues with the young and with adults for malaria than anything else. So you come back, water drainages, it is the health sector that will feel the effect. Rivers next to your house that would have puddles around. Wherever there is a mosquito coming up, it is the health sector that would have to manage the issues. So I think as a country, a major gain was made when we had something like 4 million bed nets that we are distributing as at now. Since we may not be in a position to control all the other factors, yet we are in a position to control close enough and ensure that you are not exposed to mosquito bites, whilst we interrelate with the other ministries to ensure that you do the right thing.
According to a modeling analysis conducted by WHO and partners, undertaking the 2020 nationwide mass LLINS campaign and continuing to provide malaria prevention and control services will avert an estimated 13,000 deaths and reduce the number of malaria cases by 29% in the country in 2020 alone.
In a tall order, but we are really working towards that. The agency that partners with government of Sierra Leone is Global Fund. Global Fund supports this government for 3 sectors: TB, HIV, and malaria. And that involves malaria test kits, malaria drugs, med nets, and advocacy.
Sierra Leone has achieved vast declines in malaria deaths between 2010 and 2015, the highest in West Africa. This is linked to a range of interventions including increased availability of diagnostics tests, free treatment and mass distribution of insecticide-treated nets. The sensitization message from different partners circle around early diagnosis and prompt treatment, sleeping under a treated bed net, and government's commitment to reducing new malaria infections by 40% by 2020. Most families, however, tend to visit pharmacies instead of going to hospitals, especially during this COVID-19 pandemic, as people fear that they will be pronounced COVID-19 positive instead of malaria. Peter Kalawasise is in charge of Lucky Pharmacy in the heart of Freetown.
Well, I can't say we don't treat any people for malaria. People coming out with prescriptions. We don't treat per se. We don't treat. When they come out with prescriptions, okay, we send malaria medicines to them. Well, presently, I see some people, they fear going to the hospital because of this COVID sickle, this COVID virus. So they fear going to the hospital. So most of them go to mushrooms clinics. See, most of them, they go there. We get here a few prescriptions from the hospital only.
Mass distribution of long-lasting insecticide-treated bed nets was done in the country's capital city, Freetown, and its suburbs to complete a nationwide household distribution of 4.6 million mosquito nets. The campaign started in mid-May, with nets distributed in 14 of the country's 16 districts. The remaining 2 districts, Western Area Urban and Western Area Rural, in the capital and its suburbs, account for around a fifth of the 7 million population and has also been accounting for nearly 60% of the confirmed COVID-19 cases. But with all this, testimonies from ordinary Sierra Leoneans is that they still often and now get sick with malaria.
That's the most common sick way I can say. But normally I'm not in the hospital because I get medical support. They will treat in my house. Yes. Well, I go there, check me, they may say I get malaria, they prescribe medicine, they take medicine. From there, come back and take like some time they really.
The commitment from government is still unshaken, even amidst the COVID-19 pandemic. This, the Minister of Health and Sanitation, Professor Alpha Tijanui, assured in 2021 to come.
We are now going to work towards full-fledged eradication of malaria. So the very first step was the distribution of the bed net. And now to ensure whenever you access a hospital, it is free, the test and the drugs. But we have to ensure we have the distribution network well, because every PHU should be in a position to give you that service. Okay? So malaria is one way which we are going to put all our hearts on to ensure we eradicate in Sierra Leone. Whilst we work towards expansion of services for HIV and expansion of services for TB as well.
It is no secret that the country's health sector still struggles with malaria. Conditions that favor the presence of the parasite are present in not only rural areas, but even the country's capital. And with the stigma and fear attached to COVID-19, it is making it difficult for malaria to be eradicated anytime soon.